Hi, my name is Kate Milley. I'm a VAD coordinator here at Mass General, and I'm here to teach you how to change the dressing on a Driveline exit site in a patient who has a VAD. So to start off, I would recommend having your patient lying pretty flat in a place where you can reach both his abdomen and the table that you're going to be working on. Clean the area here. I've already cleaned this down, but spray it down with something to make it super clean, and then wash your hands. I have some hand sanitizer here that I'm going to use. Everything that you need to change the dressing is actually in this kit right here. So start by taking the top of the kit off. You can throw the top off. Inside of every kit, there's actually step-by-step directions. So if you're not 100% sure or this isn't second nature yet, you can open up the directions, put them off to the side somewhere, and refer to them as you go. The next thing in the kit here is a pair of clean gloves and 2 masks. Start by putting one mask on yourself and put the other mask on the patient. We don't need masks, we already have them on right now. These gloves are not sterile, they're just clean. So it's like taking a pair of gloves out of a glove box. So open them up, put them on. You don't have to be super careful how you put them on because they're not sterile. There's also an alcohol prep pad on top of this kit. You can use that to take off the dressing that's on the patient right now. We're going to start by taking the anchor off. I pull the wings through and slowly holding one hand taut on the skin and the other hand pulling the dressing off. Just go nice and gentle so you don't rip the skin. If it's really tight on there, then you can use the alcohol prep pad. I'm going to use that for this. To take this dressing off, there's one dressing down here that you can see is already starting to come off a little bit. Hold one site with one hand, hold the other with the other hand, and pull. It's actually perforated down the side, so it makes taking the dressing off nice and easy. Put this in the trash. I'm going to use this just to make sure I don't cause any skin irritation. And what you would do is just brush the alcohol pad on the skin, and the dressing comes right off. That way you don't irritate anything or cause any pain, especially if there's hair on the abdomen. I'm being extra careful to not touch the actual site of the Driveline exit site because you want to keep that area nice and clean. So that's now come off. I'm going to take my clean gloves off and put them in the trash along with the wrapping it came in. Now I'm going to take the sterile part of our dressing out and lay it down on the table here. I recommend that you open the kit with the first flap being pulled away from you because you can work left to right if you do it that way. On the left side, on my left side, there's a pair of sterile gloves, then there's some cleaning equipment in the middle, and then there's your dressing on the right side. Everything on this sheet is sterile, so you cannot touch it with your own hands. You need to put your sterile gloves on first. Also, you can't touch this site with clean hands either. You must have your sterile gloves on. So you can touch this, you can lift it up, you open the sterile glove package on the side. There are little folds here that you can use to put your fingers underneath and pull open. Being careful to not touch the gloves themselves. Pull them open, give them a little tug to keep the paper open. Sterile gloves are laid out like this with the cuffs of the glove folded over because you can't actually touch the glove itself. You need to touch the cuff with your dirty or bare hands. So you can touch this cuff. Put one hand in. I'm left-handed, so I always put my right hand in first. And you put that glove on first. So this glove now cannot touch anything but what's in the sterile field. So I can pick the other sterile glove up by reaching under the cuff here because this is dirty and this is sterile. Then I put my hand in and I now have 2 sterile gloves on. Then I move to the next step. These alcohol prep pads don't do anything, but we have 3 sterile saline wipes here. The idea is we're going to take this bio patch off actually. Throw that in the trash. The idea is to treat the Driveline exit site like a bullseye or a target, like a dartboard. So the center is the bullseye. You're going to clean that first. Then you're going to go out to the first ring of the target and do that. Then you clean the second ring. So I'm going to start by cleaning the bullseye part of the dressing. And just look at the site, give it a nice clean. You never want to drag anything towards the exit site. You don't want it to get infected by pulling any bacteria on the skin towards the exit site. My next saline wipe is going to be for the first ring of the bullseye or of the target. So we'll go around in a circle here, and we'll clean that first ring. Throw that out. My third saline wipe, I'll clean the second ring of the target, getting farther out every time. This is nice and clean. And then we're going to go for the chlorhexidine applicator. The chlorhexidine applicator here has 2 wings. There's some chlorhexidine fluid inside the stick, and to break the seal, you squeeze the wings until you hear the click. Hold the chlorhexidine upside down so you can see the chlorhexidine saturating the sponge. Once you see it, you start again at the bullseye, the center of the target, and slowly clean outward. And you throw it out. Next, you have the protective wipes. These are skin protectant wipes. One is for the Driveline exit site itself. The other one is for the anchor, when you apply the anchor. And you would actually put one in a square around the exit site that will hold the dressing. This protects the skin from any adhesive, and it will also help the adhesive stick to the skin better. While that's drying, you put the bio patch on. The bio patch here goes on once the skin has been cleaned and prepped. You open this package up. There's a blue and a white part to this patch. The blue patch, the blue part of the patch, faces the sky. You can think blue sky, blue patch. So that goes up. The white spongy part of the bio patch goes onto the skin. There's a little break in the patch here that can go around the Driveline when you lay it down. So lay it right on top, let the 2 edges sort of hug the Driveline, lay it nice and flat. We've now had some time to let the skin dry, so we cover up the exit site. This patient only needs 2 gauze, so we'll just take 2 of the gauze and put the rest to the side. If your patient is having more drainage out of the exit site, please use all of the gauze so we can soak away any moisture. Fold it in half and lie it along the Driveline. Once you're ready for this Driveline dressing, you pull the first flap here, the large flap. Stick this onto the patient, and then you pull the second flap. So you'll lay the gauze on top following the Driveline. Lay this on top and press. Then you can remove the second wing and close the bandage around the Driveline. Throw this out. The next part of the dressing is the smaller piece. This section goes under the Driveline to create an occlusive dressing. Flip it over, pull one flap off, and then pull the other flap off. And then stick this right underneath the Driveline dressing. Go under the Driveline here, and you make this Driveline occlusive by putting that around the other side of the Driveline. So now we've got the dressing covered. We're no longer worried about sterile procedure because the exit site is covered. And then we're going to add the anchor. So we have one more piece of skin protectant. We're going to add it right here along the side of the abdomen. Let that dry for just a few minutes. The anchor here has 2 wings on it to secure the Driveline in place. This wing goes over the Driveline, which is lying right here, and goes into this hole. Once the wing has gone through the hole, you pull so the flaps lock into place. If your anchor has an arrow on it, my recommendation is to have the arrow pointing up to the patient's face. It tends to keep the anchor on longer. I don't know why. To remove the back, you just pull each tab and you bring it over to the patient. Put this on the skin. And then put the Driveline right here, putting one of the wings into the hole of the other wing and pull until they are together. And that's how you do it. Everything's done, everything's covered, and that's the end of our dressing change. And this is what the final product of the dressing change should look like. You want to be able to get a finger underneath the Driveline here so it's not too tight, but the edges of the bandage should be completely affixed to the skin. There shouldn't be any openings, and this should have a little bit of give there. But this is how the end of the dressing should look.